Real Country 1430 AM and 107.3 FM WRDN. I'm Brian Winnikins, and joining us right now, Pepin County Health Officer Heidi Stewart, as we get an update on the COVID-19 situation here in the county. And Heidi, again, thank you for joining us. Well, a couple weeks back, we had a testing site here in Durand. I think that was actually last week. How did it go?
It was actually last Tuesday. The weather cooperated with us, and the Wisconsin National Guard crew was here in Durand. They tested people from 10 to 6 p.m. When I looked at the list and I looked at the testing times, it looked like they were a little bit slow between like 11 and 2. Otherwise, there looked to be a pretty steady trickle of individuals coming in. We did test over 50 individuals that day, and I'm happy to say that the largest amount of those individuals tested was from Pepin County. There were some from the surrounding counties, which you can expect as we all live, work, and play in different areas, but a good portion of that was from our county. Now that is going to continue. We are going to have another testing day on the 8th, same location, the Pepin County Highway Shop here in Durand. It's drive-through. It's really convenient. You pre-register. You can check our website for that pre-registration link. The turnaround time at this point for the National Guard testing sites is about 3 days. So those results come back. Certainly our local facility here in Durand, Advent Health, is continuing to do their testing as well. We're very fortunate right now that their turnaround time does continue to stay either same day or within about 24 hours. So still a much better turnaround at our local facility here, which would be Advent Health. But all in all, the testing site went very well.
And after the 8th, there's a possibility that there might be another time that the Guard would come back?
Yeah, so we were told initially that National Guard resources would end middle of December. We've received notice that the National Guard resources will be extended for testing. That will either be funded by federal dollars, or that if federal dollars don't come through, then it sounds as though there will be state funding for ongoing testing if needed. As long as we continue to have a good response here in Pepin County, we will continue to work to provide that. Some of the challenges coming up that we've talked about a little bit internally are the assuring that the National Guard has a heated space to do the testing, assuring that we're not interfering with the highway operations and what they need to do.
Especially if there's a snowstorm.
Yeah, especially if there's a snowstorm, yes. So, there's things to continue to look at and talk about, but as long as there's a need and as long as people turn out for it, we will continue to request it for our community.
Talking with Pepin County Health Officer Heidi Stewart today, an update on our COVID-19 situation. Heidi, where are we at with the numbers? We've seen all around, it seems like everybody's a hot spot. Are we kind of in that hot spot as well?
Yeah, my screen sharing isn't enabled, but if you look at the Harvard model, we're all high, we're all red, everybody is. There continues to be hot spots. There is some good news though, and the good news would be that our daily case rate right now, that 7-day rolling daily case rate, is 5.1 cases per day. So we're averaging about 5 new cases a day. There were days in the middle of November that we were in the 20s. I believe our highest day to date during this pandemic would have been 34 cases on one particular day, which is a lot. We continue to see high turnout for testing, and we continue to see probably around 50% if we did an average of the amount of tests done recently in the last month. About 50% of them come back positive. We did have a few days where we had 5 individuals tested. All 5 came back negative, which was great. We had another day where we had about 30 people tested and 20 of them came back positive. So there's still a lot of the virus out there, and we still need to continue to take precautions. We did go over 500 cases today for Pepin County. 54 of those are still active. We currently have 4 individuals hospitalized. Our total hospitalizations since the beginning of the pandemic is 18. So that number is a little higher than I think the last time we spoke. And we're still at 2 deaths for Pepin County.
Talking with Pepin County Health Officer Heidi Stewart today on our COVID-19 update. Heidi, I know some of the reporting that the county does and some of the data that you receive. I remember in the beginning, it was just like real rudimentary information we would get, but now it's becoming incredibly detailed. Tell us about that.
Yeah, so released today, if you visited the Wisconsin Department of Health Services webpage, if you go to COVID and then go to summary, Wisconsin summary, that page has all the statistics on deaths, confirmed cases since the beginning. And they actually have a mapping system now that it's gotten down to pretty significant detail. Looking at the map, you can look at the different counties and get the county snapshot. You can also look at specific school district boundaries and get those school district snapshots of what's going on in the community of the school district. Now, I do want to point out that this does not mean that these cases are in that school district. It's not a representation of the school district or the school buildings themselves. It is the community that lives within those school district boundaries. So that's important to note and to make sure that you're looking at that. When you're looking at those school districts, you can also click on the villages, the townships, basically the municipalities, and see where there's high rates. I actually took a peek at it today, and I was kind of surprised based on what we see coming in on a daily basis. It comes in as Durand, but that really could be a lot of different places, a lot of different townships that have a Durand address. So I looked at that a little bit today, and I would encourage anybody that's interested in that to do the same. There are 12 facility investigations going on. It sounds like a judge in the Madison area again blocked DHS from listing on the website the specific facilities that have what they are calling an outbreak, which is 2 or more epi-linked cases. On that website, though, the long-term care facilities continue to be listed where there's outbreaks, epi-linked, 2 or more epi-linked cases. And on there today, there are no Pepin County facilities listed. So that's good for our assisted livings that we have here. I wanted to mention that while we may be seeing a little bit of a plateau, or in some cases, maybe even a little bit of a decline in some of the activity, our hospitals, they're seeing a little bit of a decline. They're in a much better spot this week than they were 7 days ago, as far as ICU beds, as far as med-surg beds. But we still can't ignore the fact that we're still all very, very high. I mean, I remember months ago thinking, well, we'll never be to this high red Harvard level, we're in the green. Oh my gosh, we're in the yellow one day. And then, we slipped into orange, which is another level up, and then we would slip back. We've been in red for a long, long time. So even though things feel like they've plateaued a little bit, we need to stay vigilant in doing some of the mitigation things, the staying home, the wearing of the mask, the washing our hands, the physical distancing. That message continues to be the same.
Talking with Pepin County Health Officer Heidi Stewart today. And Heidi, I know just before we did this meeting, CDC came out with some new guidelines.
Yeah, so about an hour ago, I know there's been rumors on the news. CDC did come out with some new guidelines. I'm reading it directly off of my screen because this is really, really new. It's titled Options to Reduce Quarantine for Contacts of Persons with SARS-CoV-2 Infection Using Symptom Monitoring and diagnostic testing. So it does say right in this document, in my brief review of it, that the CDC continues to recommend the full 14-day quarantine, but studies have shown that the amount of spread and when others are being infected, it is happening early within the first 5 days for the most part, and then day 6, day 7, day 8, day 9, day 10 continue to taper off. And there's somewhere between a 1 and 10% chance of somebody between day 10 and 14 being infectious. So there is some risk with this, but I believe it is an attempt for the CDC to maybe gather some compliance back to some degree, to know that we have a long way to go yet with this, and to come up with a strategy for us continuing to move forward, and to do it in a safe manner. So what needs to happen now is the Department of Health Services needs to review this, and they will most likely within the next day or two adopt some of the changes. They may adopt it fully. They may look at it and say that they don't feel comfortable with the state of Wisconsin fully transitioning to the new guidance. And this isn't new. The CDC guidance has been different. The DHS guidance has been different than the CDC in a few different things. And we'll just have to work through it and figure it out and get some messaging out to the community on it. When I talk about, this isn't over, or this isn't going to end anytime soon. So this being maybe an option for ongoing efforts and ongoing work around quarantines. We have learned that the phase 1 vaccine should be coming out. The vaccine should be coming out very, very soon. I think it's important for everybody to realize that phase 1 is a very limited number of people in Pepin County. It's likely that our allotment in Pepin County will be very, very small. It's likely that it will go directly to our healthcare system here in the county, and they will vaccinate their own individuals. So the Pepin County Health Department will not be receiving any of the vaccine in phase 1 for vaccination purposes. So we're working with those individuals that qualify in phase 1 to make sure that they get it and can receive the vaccine. We heard on a call yesterday that the rollout, phase 1A, phase 1B could take a significant amount of time, and we may not be to phase 2 until the end of the first quarter or well into the second quarter of 2021. So just trying to put a little bit of a time frame on that for everyone. And it's exciting that a vaccine is available. Hopefully it is effective and will help some of those individuals on the front line early on. And then we will work to get it to the rest of the community as the phases progress.
So is that phase 2 then for more like general population, or is that like a 3, 4, or 5 where we might be looking at June, July, August?
Yeah, I really think that, well, to the best of my knowledge, there's 3 phases. A good percentage of our population, I believe, will fit into phase 2. General public will most likely be phase 3, and that could be the end of next year for some of those in phase 3.
Wow. All right. Well, Heidi, again, we appreciate you joining us today.
Thanks, Brian.
That is Pepin County Health Officer Heidi Stewart. You're listening to WRDN.